I am S. Julianne Lloyd. I am a bariatric surgeon at Baylor Medicine in Houston, Texas. So when our patients come in to see us, they have an initial one-on-one consultation with the surgeon. In that meeting, we'll typically go through their past medical and surgical history, and we'll talk about their weight loss goals, what their expectations are. We'll review all the surgical options, which include sleeve gastrectomy and a gastric bypass, in addition to some other procedures. I would say those two are the two most commonly performed procedures in the United States. We'll review everything with the patient and use a shared decision-making process and tailor the type of surgery that we decide for each patient just based on their individual needs. In the days leading up to surgery, we'll have patients come in and do a pre-op visit with us. At that point, we'll go through specifically what they can expect in the hospital and afterwards in terms of their immediate recovery. We'll go over all of their medical records and make sure that we don't need to do any additional lab work or any final testing before they come in for their procedure. And really, it's an opportunity for us to talk a little bit more about the surgery itself. We typically will go through the consent form as well and just have an open discussion with the patient. I know most times when patients come in at that point, they start to get a little nervous. So, we'll field questions from them and try to put their mind at ease about the surgery itself. On the day of surgery, patients will come in a couple hours before they're scheduled to start their surgery. They get to meet everyone on the team, including the anesthesiologist, all the nurses who will be in the room. We get them ready, put in an IV, get them down to the pre-op area, and then we'll wheel them back to the operating room. They will then be put to sleep. They have a breathing tube inserted to assist with breathing during the procedure. And then depending on the type of surgery they have, it will typically take anywhere from an hour to a couple hours to get the procedure done. And then afterwards, we'll wake them up, take them to the recovery area, and they may end up staying in the hospital overnight, maybe a couple nights, but some of our patients even get to go home the same day, depending on what procedure we're doing. We are performing surgery on patients, and it requires incision, so unfortunately they will have some pain. But we do give them pain medication to keep their pain level at a relatively low rate. After surgery, we'll start them initially on a clear liquid diet, and as long as they're able to tolerate that, then we'll advance them slowly. They'll eventually be able to get back to eating most of the things that they had before surgery, but the quantity in which they can take these doses is definitely reduced. The decision to have bariatric surgery is a lifelong commitment. And in fact, sometimes I'll joke with the patients that really it's a marriage between me and them because I expect to see them every year for the rest of their lives. They have to implement changes that they'll continue throughout the rest of their lives as well. So they'll have to change the way they eat, they'll have to exercise regularly after surgery, and they'll have to take vitamins as well to ensure that they don't develop any nutritional deficiencies.